Have you ever sat in the vet's office, just nodding along when the doctor says, like, hey, let's just run some routine blood work today?
Oh, yeah, absolutely. We've all been there.
Right. You smile, you agree, you go up to the front desk, and you pay a pretty hefty bill. I mean, maybe $200 or more.
Yeah, easily.
And then you walk out to your car. And as you're turning the key, you quietly wonder to yourself, like, what did I actually just pay for? What does any of that even mean?
Well, if you're listening to this and nodding right now, you are definitely not alone. I mean, blood tests are arguably the most common recommendation in veterinary care,
For sure.
but ironically, they are the exact thing pet owners consistently feel the least equipped to understand. Like most of us just look at a printout of random letters and numbers and
And we just trust the process, right?
exactly, we just trust it. But our mission for this deep dive is to change that dynamic. We aren't here to turn you into a certified lab technician, obviously. But we want to decode the mystery of veterinary blood tests so you can stop feeling like a passive bystander in the waiting room.
Right, and start being a true active partner in your dog's healthcare. Okay, let's unpack this with a story from our sources because I think it perfectly captures this universal pet owner friction.
Sorry about Tom, right?
Yeah, Tom and his 6-year-old Labrador, Hank. So Hank is the absolute picture of health. I mean, he's energetic, he eats like a horse, he plays fetch until his arm falls off.
Sounds like a typical lab.
Exactly. So Tom brings him in for a routine annual wellness visit. The vet examines him, says everything looks great, but recommends some routine blood work just to be thorough.
And immediately, Tom spirals,
Totally. He just freaks out.
which is completely human.
Yeah.
I mean, the moment a doctor says blood work, our brains immediately jump to the worst case scenario. We think, oh no, what's wrong? What are they secretly looking for?
Right. Tom assumes the vet is hiding something or has a hunch about some terrible silent disease. But fast forward a few days, the results come back and they are perfectly normal.
Which is great news.
It is. Tom is incredibly relieved, obviously. But then it hits him, he learned absolutely nothing.
Yeah.
The anxiety was resolved, but the actual information was a total blank. He just paid for a piece of paper that says normal.
And that feeling of like paying for nothing is exactly why we need to lay down a golden rule before we get into the actual science of what that paper says.
Yes, the disclaimer.
Right. This deep dive is purely educational. We're going to break down the mechanics and the immense value of these tests. But interpreting your dog's specific lab results is always a job for your veterinarian.
Right. Don't use this deep dive to go diagnose your dog on the internet at 2 a.m.
Please don't. Blood test results, they do not exist in a vacuum. They have to be read alongside a physical exam, clinical signs, and, well, your dog's unique health history.
Got it. But let's go back to Tom's initial panic. It really stems from a fundamental misunderstanding of why vets even draw blood in the first place.
Yeah, it really does.
Because if you're looking at a dog like Hank, who is bounding around the yard and eating all his kibble, why go looking for trouble? Like, why fix what isn't broken?
What's fascinating here is that we tend to think of the body as this machine that will instantly flash a warning light when a part is wearing out.
Right, like a check engine light on a dashboard.
Exactly. But animals have an evolutionary imperative to hide weakness. Organs do not send visible distress signals right away.
Really? So they just hide it?
Yeah, they are incredibly resilient. They will biologically compensate for damage for a very long time before you ever see your dog start to act sick or slow down or, lose their appetite.
Oh, wow.
Like kidneys, for example. They can lose a massive amount of their functional capacity before a dog even starts acting unusually thirsty.
So by the time I actually notice my dog is lethargic, the internal damage might already be pretty advanced?
Precisely. And that's exactly why vets draw blood in 4 distinct contexts throughout a dog's life.
Okay, what are the 4?
The first context is exactly what Hank went through, wellness screening.
Just a standard checkup.
Right. It's about catching those quiet issues early, well before the compensatory mechanisms fail. Because catching conditions in their early stages often means you have significantly more management options.
And probably better long-term outcomes, right?
Far better.
Okay, so if wellness screening is about catching the quiet issues on a normal day, what happens when you introduce an external stressor? Like, say my dog needs to go in for a procedure.
That brings us to the second context, which is pre-surgical screening. Anytime your dog needs to go under anesthesia, the vet has to be absolutely sure the internal systems can handle it.
Because anesthesia is hard on the body.
Exactly. They're specifically looking at the organs responsible for processing and clearing those anesthetic drugs from the body. That's primarily the liver and the kidneys.
And I want to pause here because our sources make a point that really surprised me. This isn't just for, like, major abdominal surgery.
No, not at all.
Even routine procedures, like a standard dental cleaning, require anesthesia. And because they require anesthesia, they require that pre-surgical blood clearance.
That's right, because if those organs aren't functioning at 100%, the vet might need to change the specific type of anesthesia they use.
Or maybe adjust the IV fluids.
Yeah, or even postpone the surgery entirely, just to keep the dog safe.
Makes sense. Okay, what's the third context?
Monitoring. If your dog already has a known health condition like thyroid disease or diabetes, or if they're taking certain long-term medications for something like arthritis, well, blood work is how we track that internal landscape.
So making sure the meds aren't causing other issues.
Exactly. It tells the vet how the disease is progressing over time or how the liver is tolerating that daily medication.
Got it. So we have wellness, pre-surgical, and monitoring. I assume the fourth one is what everyone naturally jumps to, diagnostic testing.
You got it. Diagnostic testing happens when your dog is actually unwell and the vet is trying to figure out why.
So when the check engine light is actually on.
Right. In that scenario, blood work acts like a compass. It helps narrow down the possibilities by identifying which specific bodily systems are actively struggling.
So what does this all mean? It basically means blood work is a proactive window into your dog's health, not just a reactive alarm bell.
Beautifully said.
But that begs the question, what exactly are we looking at through that window? Like when they take that vial to the back room, what are they measuring?
Well, there are two main types of tests that you will encounter on almost every standard lab panel. The first is the complete blood count, usually abbreviated as the CBC.
Okay, the CBC. I always try to visualize this stuff to make it make sense.
Oh, visualizations are great for this.
Yeah, so I like to think of the CBC as a military roll call. Like you're looking at the bloodstream and you're literally counting the troops.
That's a good way to look at it.
You want to know how many soldiers you have, what specific roles they are playing, and, if they're properly equipped for the job.
That is a perfect analogy, honestly, because the CBC is strictly looking at the physical, cellular components floating in the blood.
The physical troops.
Right. And there are three main squads of troops we care about here: the red blood cells, the white blood cells, and the platelets.
Okay, let's start with the red blood cells. These are the oxygen logistics team, right?
Yes. Their primary job is to bind to oxygen in the lungs and carry it through the highway of the bloodstream to every single tissue in the body.
So if you don't have enough of them,
then your dog is anemic. Structurally, if you don't have enough oxygen reaching the muscles and organs, you're going to see physical symptoms, things like profound fatigue, pale gums, and overall weakness.
But the vet isn't just counting how many there are they? Like, it's not just a sheer numbers game.
No, and this is where the equipped for the job part of your analogy comes in perfectly. The CBC also tells the vet the physical size of these cells and how much hemoglobin they carry.
So quality over quantity.
Exactly. Even if the total number of red blood cells is normal, if the cells themselves are too small or too pale, they simply can't carry oxygen effectively.
Okay, so that's the red blood cells. Next up in the roll call, the white blood cells. These are the immune system's frontline troops.
Right. And this is where it turns into a bit of a detective story for the vet, because you don't just have one generic type of white blood cell.
Oh, really?
Yeah, you have highly specialized units designed to handle vastly different threats.
Like what?
Well, some are heavily armed to fight off bacterial infections. Others are specialized to attack parasites. Some manage allergic responses, and others handle viral threats.
This is the part I find incredible. The blood test isn't just a simple alarm saying, hey, the immune system is activated.
No, it's much smarter than that.
It's actually giving the vet a massive clue as to what the immune system is actively fighting.
Mechanically, it's brilliant. Let's say a vet looks at a CBC and sees a massive spike in a very specific type of white blood cell 1 called an eosinophil.
An eosinophil. Okay.
Right. That specific cell specializes in fighting parasites and allergic reactions.
Oh, wow.
So the vet instantly knows they can probably stop looking for a bacterial infection, and instead, they need to start looking for a worm or an environmental allergy. It completely shifts the diagnostic focus.
That makes so much sense. It narrows the search grid immediately. And the third group in this CBC roll call are the platelets.
Platelets are the clotting crew. They are the tiny cells that rush to the site of an injury and clump together to patch the hole and stop the bleeding.
So if a dog has too few platelets...
They are at a severe risk for uncontrolled internal or external bleeding.
Wow. So that's the CVC, the cells, the physical troops in the blood.
Yeah, the physical components.
But as I understand it, the cells are only half the story. The blood isn't just a troop transport vehicle, it is also the body's primary chemical highway.
It is. Which leads us to the second major test, the one that usually takes up the most space on the printout, the blood chemistry panel.
Here's where it gets really interesting. Because the chemistry panel isn't looking at whole cells anymore, is it?
No, not at all.
It's looking at the substances dissolved in the blood fluid itself. I've heard this described as an organ report card, but that always felt a little, I don't know, passive to me.
Yeah, it's a bit dry.
Based on the sources, it feels more like checking the exhaust of a car. Like we aren't opening up the engine to look at the parts. We're looking at the smoke coming out of the tailpipe or the fluid in the lines to deduce if the internal belts and filters are actually working.
I love that. It's exactly like checking the exhaust. The organs are constantly pulling things out of the bloodstream and dumping waste products back into it.
Okay.
So by measuring the specific levels of enzymes, proteins, and waste products dissolved in that fluid, we can reverse engineer how well those organs are performing their specific jobs.
Let's run down this system, starting with the liver. Because I get how the kidneys act like a filter, but the liver always confuses me. Is it a filter or is it a manufacturing plant?
It's the ultimate multitasker, honestly. It's both.
Oh, okay.
The liver processes nutrients from the food your dog eats, it manufactures vital proteins, and it filters out toxins. But the way we test it is fascinating. The chemistry panel looks at specific liver enzymes.
Just floating around?
Well, normally those enzymes belong inside the liver cells to do their work.
Wait, so if the enzymes are supposed to be inside the cell, why are we finding them floating in the bloodstream?
Exactly. If the vet finds high levels of those enzymes in the blood highway, it literally means the liver cells are damaged, stressed, or bursting open.
Oh, wow.
And their internal contents are leaking out into the blood. So elevated liver enzymes aren't just an abstract number. They are a physical indicator of cellular damage.
That is a crazy visual.
Yeah.
Just cells popping and leaking enzymes. Okay, what about the kidneys? We know they act like a coffee filter for the body.
Right. Their job is to pull waste products, specifically byproducts of protein breakdown, out of the bloodstream so they can be excreted in the dog's urine.
Right.
The chemistry panel measures these specific waste markers in the blood. If the kidney's filtration system is failing, it can't pull the waste out.
So the waste just backs up into the tailpipe.
Exactly. The waste backs up into the chemical highway.
Yep.
If those kidney markers are high, it tells the vet the filter is clogged or failing.
Let's talk about glucose. I mean, we hear about blood sugar all the time with humans.
It's just as important for dogs. Glucose gives the vet critical information about metabolic function.
They're like diabetes.
Yes.
Mm-hmm.
If you see consistent abnormal spikes in glucose, the vet is immediately thinking about how to diagnose and manage conditions like diabetes, where the body can no longer regulate its own fuel supply.
The chemistry panel also measures proteins and electrolytes. Now, I know electrolytes from sports drinks, but what are they doing in my dog's blood?
Think of electrolytes, things like sodium, potassium, and chloride, as the electrical grid and the battery fluid of the body.
The electrical grid. Okay.
They maintain hydration, sure, but more importantly, they conduct electrical impulses. If your dog's electrolytes are out of whack, the electrical signals literally misfire.
Wait, really? Like muscle spasms?
Exactly. It can
Okay.
affect everything from their heart rhythm to their muscle function. It's a really critical measure of systemic balance.
There's one more major player mentioned in our sources, though it's sometimes run as a separate test, and that's the thyroid.
The thyroid gland is basically the body's thermostat. Thyroid hormone levels dictate how fast or slow the body burns energy.
So if it's too low,
If the thermostat is set too low, which is extremely common in older dogs, their metabolism crashes. They gain weight, they lose energy, and their coat gets incredibly dull.
oh, poor things.
Yep, testing it is vital for certain breeds, and it becomes a huge priority as dogs transition into their senior years.
Okay, so we have the CBC checking the physical cells and the chemistry panel checking the exhaust to grade the organs. It is a massive, overwhelming amount of data.
It really is.
Which leads me to some pushback. Let's say I get the printout from the clinic. It has a column for my dog's actual results and a column next to it showing the standard normal range.
Right, the reference rate.
Yeah. So if a number is too high or too low, isn't that a clear-cut answer? Like high means bad, normal means good. Why do I need a vet to translate that? Why shouldn't I just read the printout myself?
If we connect this to the bigger picture, you'll see why that is a genuinely dangerous game. In laboratory medicine, context is literally everything.
Context.
Yes. A number on a page does not equal a diagnosis. Let's take the white blood cell count we talked about earlier. A slightly elevated white blood cell count means entirely different things depending on the entire matrix of data.
Like what else is going on with the dog?
Exactly. Is the dog showing a fever? Are the kidney values off? Or is the dog just severely stressed from being in the vet clinic?
So one abnormal value is just a starting point. It's a clue, not the final verdict.
Exactly. You cannot diagnose a dog based on one bolded number on a lab report. The vet is trained to look at how all these different systems interact with each other.
Which brings up what I think is the most mind-blowing, counterintuitive point from our sources. And it goes back to our guy Tom, who felt like paying for perfectly normal results was a waste of money.
Oh, it is the most common misconception in veterinary medicine. A completely normal test is incredibly valuable data
Why?
because it establishes your dog's personal baseline.
I really want to focus on this because this changed how I view the whole process. The normal range printed on that lab report, it's just a statistical bell curve of thousands of different dogs, right?
Yes, it's
Yeah.
a massive average. But your dog is a unique individual.
Yeah.
Let's say the normal range for a kidney marker is anywhere between 10 and 30.
Okay, 10 to 30.
When your dog is young and perfectly healthy,
Yeah.
their personal normal baseline might sit at an 11, right at the very bottom of the range.
Okay, that makes sense.
Now, imagine you never get blood work done until your dog is 6 years old. The vet runs the test, and that kidney marker comes back at a 29.
Well, 29 is under 30, so it's still in the normal range on the printout. I'd assume my dog is totally fine.
And a vet who has never seen your dog before might look at that 29 and say, well, technically it's in the normal range.
But it's not.
Right. If they had your baseline, they would realize your dog's kidney values have nearly tripled from their personal normal of 11.
Wow.
Even though the number hasn't crossed the official threshold into abnormal, your dog has likely lost a massive percentage of their kidney function.
So without that healthy baseline, the vet is just flying blind.
Completely blind. They wouldn't catch the disease until the marker hit 35 or 40, at which point the damage is severe.
That is terrifying, but also incredibly motivating. Like, normal results are the anchor that makes all future abnormal results meaningful.
Perfectly said. Knowing what your dog's normal looks like over time is the only way a vet can mathematically identify meaningful shifts before they become critical, irreversible problems.
And how does age factor into this timeline? Because obviously a puppy is processing life differently than a senior dog.
Oh, age compresses the timeline dramatically. For young, healthy dogs, depending on their lifestyle, an annual check might be perfectly fine.
Right.
But as dogs transition into their senior years, their internal landscape ages much faster than ours does. What feels like 1 year to us is a massive percentage of a dog's lifespan.
Right. The whole dog years concept isn't just a myth. It's an actual metabolic reality.
Exactly. Things degrade quickly. A senior dog's organ function can shift drastically in just 6 months. That's why many vets shift their recommendation from annual blood work to testing twice a year for senior dogs.
Right. We've gone through the why, we've looked at the cells, we've checked the chemistry exhaust, and we've established why those personal baselines are critical. But knowing all this theory only matters if it actually changes your behavior.
Very true.
Okay, let's unpack this. What exactly should you, the listener, do differently at your next vet appointment? How do we go from being a nervous passenger to a co-pilot?
Well, the very first step is simply to ask questions. When your vet recommends blood work, do not be embarrassed to ask, what specifically are you looking for today and why?
Just putting it out there.
Yeah, it immediately changes the dynamic in the room. It shows the vet you are an engaged partner.
And when the results actually come back a few days later, don't just call the front desk and ask, hey, is it normal?
Right. Ask to review the results with your vet. You don't need them to explain the biochemistry of every single cell. Just ask them to point out the story the results are telling.
Even if it's normal.
Yes. Ask them what stood out, even if everything fell within the normal range. And crucially, if they find a borderline number and suggest coming back in 3 months to recheck it, you need to take that seriously.
Because a trend is vastly more informative than a single snapshot.
Exactly.
Yeah.
Catching a trend gives your vet a massive head start.
This all really highlights the absolute importance of keeping your own longitudinal medical records. I mean, yes, your primary vet has a file on your dog,
Yeah.
but if you're traveling, or you have to go to an emergency clinic on a Sunday night, or you get referred to an oncologist, they need that history to establish that baseline we talked about.
Having your own organized records is a total game changer for veterinary teams.
Mm-hmm.
Being able to see last year's blood work right next to this year's, immediately in the exam room, it allows for instant, informed decision-making.
And the good news is you don't have to carry around a giant, messy binder full of crinkled papers anymore.
Thank goodness.
Yeah, our sources highlight that there are digital tools designed exactly for this. Apps like VitalPet allow you to build a complete, centralized health record for your dog right on your phone.
That's so convenient.
It is. You can store their blood test reports, track daily medications, log vaccine history, and even note subtle symptom changes. It doesn't replace your vet's expertise, obviously, but it ensures you walk into any appointment ready for a real data-driven conversation.
Rather than desperately trying to rely on your memory while you're stressed out in an emergency room. That level of organization fundamentally elevates the quality of care your dog can receive. It removes the guesswork and gives the vet the exact context they need.
So to bring it all together, blood work is truly one of veterinary medicine's greatest tools. It lets us peek under the hood without a scalpel. It catches diseases before they take hold, it tracks the invisible efficacy of treatments, and it builds a mathematical narrative of your dog's health that only gets more valuable with time.
It really does.
Understanding the why behind the needle and the how behind the cells replaces that waiting room anxiety with empowered engagement.
This raises an important question, though, something for everyone listening to really mull over.
Oh, what's that?
We've talked a lot today about building a baseline of data over the years to catch disease early, but if we take a step back, how does shifting our own mindset away from just reacting to sickness and fear and toward proactively mapping our dog's lifelong health narrative fundamentally change our relationship with their aging process?
Wow, that is a great point.
Instead of fearing getting older, we are actively, purposefully navigating it with them.
I love that. It takes the fear out of the vet's office and replaces it with purpose. Thank you so much for joining us on this deep dive. The next time you are sitting in that clinic and the vet mentions blood work, don't just nod and quietly pay the bill. Ask questions, look at the story the numbers are telling, and be the co-pilot your dog deserves. See you next time.